They called her Jane Doe. No ID, no phone, no name. Just a woman in her late 40s, found unconscious in a public restroom downtown, wearing a hospital bracelet from a facility 300 miles away. And the strangest part? She wasn't breathing, but her heart was still beating. I was the night shift nurse in the ICU at Mercy General when they wheeled her in. Her oxygen saturation was 72%, dangerously low, yet she showed no signs of distress, no gasping, no panic, just stillness, like she was sleeping. The ER team had already intubated her. Scans showed no stroke, no tumor, no drug overdose. Toxicology came back clean. Her blood work, perfectly normal. It's like her brain just forgot to tell her lungs to work, the resident said, scratching his head. We kept her on the ventilator, monitored her vitals, waited for answers. Days passed. No family came forward, no missing persons matched her description. Then, on the 5th night, something changed. I was doing my rounds at 2 a.m. when I noticed her eyes were open, wide open, staring at the ceiling. "Ma'am, can you hear me?" I asked softly. No response, but her eyes tracked my movement. I called the doctor. We ran another EEG, and that's when we saw it. Bursts of intense activity in the prefrontal cortex, the part of the brain tied to decision-making, self-control, and guilt. Over the next 48 hours, her condition shifted. She started moving her fingers, tapping a rhythm on the bed rail. Always the same pattern. Short, short, long. Short, short, long. One of the techs recognized it. "That's Morse code," he said. We brought in a translator, held up a letterboard. With trembling fingers, she spelled out CLEAN. We didn't understand. Clean what? Her room? Her body? Her conscience? Then, late on the 7th night, she coded. Flatline. We rushed in. Chest compressions, epinephrine, defibrillator charging. "Clear," I yelled. The shock hit. Her body arched off the bed. And then she sat up. Not slowly, not groggily, but fully upright, eyes locked on mine, voice hoarse but clear. "Tell them I didn't mean to." Before anyone could react, she collapsed again. This time we couldn't bring her back. Time of death, 3:14 a.m. The next day, a detective showed up. He'd seen the hospital bracelet. Turns out she was Dr. Lillian Marsh, a psychiatrist from Nevada. 2 weeks earlier, one of her patients had died by suicide in her office. The family blamed her, said she ignored warning signs. The night she disappeared, she left a note. "I need to understand what silence feels like." We never figured out why her body stopped breathing. But in her chart, under final words, I wrote, "She didn't mean to." Sometimes in medicine, we chase diagnoses like treasure. We want labs, scans, names for things. But some pain doesn't show up on an X-ray. Some guilt doesn't metabolize in the liver. And some apologies are only heard after the heart stops. I still check the missing persons database every month, just in case someone's looking for her. And if they are, I'll tell them the truth. She wasn't silent because she had nothing to say. She was silent because she thought no one would listen. And maybe, in the end, she was right. But I heard her, and that has to count for something. Because in the quietest room in the hospital, the loudest thing is always regret. They say nurses see more of death than anyone, but what they don't say is that we also see the moments right before it. The last breath that isn't quite a breath. The final blink that holds a lifetime of unsaid things. Dr. Marsh didn't die from a medical condition. She died from a wound no scalpel could reach. And sometimes the only treatment for that is someone willing to stay in the room after everyone else has left. I stayed. I listened. And in the silence, she finally spoke. It's been 3 years now. I still remember the weight of her hand on the bed rail. Not strong, not desperate, just insistent. Like she was trying to carve her truth into the metal before it vanished. After the autopsy, they found no physical cause for her respiratory arrest. No embolism, no neurological lesion. Nothing. The coroner listed it as undetermined. But I knew. Grief can stop a heart. Shame can silence a breath. And sometimes the mind decides it's done, long before the body agrees. I asked the detective if the patient's family ever reached out. He shook his head. They moved, changed their number, left the state. So Dr. Marsh became Jane Doe again, not because she was unknown, but because the world chose to forget her. But I didn't. Every time I walk past room 307, I pause, not out of fear, out of respect. Because in that room, I learned something no medical school teaches. That healing isn't always about fixing what's broken. Sometimes it's just about witnessing what's true. And maybe that's enough. The hospital administration wanted to close room 307 after her death. Said it was bad for morale. I fought them. Told them every room has a story. This one just happens to be honest. Now, when new nurses ask why that room is always kept clean, I don't tell them about the code, or the Morse code, or the final words. I just say, because someone deserved to be heard. And then I walk away before they see the tears. Because in this job, you learn to cry with your eyes open. You have to. Otherwise, you miss the moments when the silent patients finally speak. And trust me, they always do. Just not in the way you expect. Sometimes it's a whisper. Sometimes it's a hand on a wrist. Sometimes it's a single word spelled out in trembling taps. But if you're listening, really listening, you'll hear it. Dr. Marsh taught me that. And I carry it with me. Every shift, every night, every time I enter a room where someone is waiting to be seen. Not as a case, not as a chart, but as a person, with a story, and a heart that, even when it stops, still has something to say. I hope one day her family reads this. Not for blame, not for closure, but so they know someone stayed, someone listened, and someone remembered. Because in the end, that's all any of us really want. To be remembered. Not perfectly, not heroically, just truthfully. And Dr. Lillian Marsh, she was human, and that was enough. I keep a small notebook in my locker. In it, I write down the names of patients who don't have anyone to say theirs. Jane Doe from room 12, John Smith from the ER waiting room, Maria something. She spoke only Spanish, and no one translated her last words. Dr. Marsh is page 47. I read it sometimes when the shifts get long, when I feel like I'm just a machine pushing meds and checking boxes. And then I remember, behind every beep, every chart, every silent bed, there's a story. And stories deserve witnesses. Last week, a young intern asked me why I still work nights after 20 years. I didn't tell her about room 307. I just said, because the quietest hours hold the loudest truths. She didn't understand. But one day she will. One day she'll sit beside a patient who can't speak. And she'll listen anyway. That's how it continues. Not through grand gestures, but through presence, through patience, through the courage to sit in the silence and wait for the hand to move. I don't believe in ghosts, but I do believe in echoes. And Dr. Marsh's echo? It's still here. In room 307. In my notebook. In the way I look at every silent patient now. Not as a mystery to solve, but as a person to honor. So if you're watching this, and you've lost someone, know this. They weren't gone the moment their heart stopped. They were gone the moment we stopped listening. Don't let that happen. Stay. Listen. Even when there's nothing to hear. Because sometimes the silence is the story. And you, just by being there, become part of it. I'm still part of Dr. Marsh's story. And I always will be. Not because I saved her, but because I heard her. And in a world that's always rushing, that might be the rarest kind of medicine there is. So the next time you pass a hospital room with the lights off, don't look away. Look in. Because someone in there might be waiting for you to listen. And their story might just change yours. This is why I stay. Not for the science. Not for the pay. But for the silence. And the voices inside it. Waiting. Always waiting. To be heard.